My surgery was robotic assisted. And I thought, well, this is cool. The hip surgeries were my first major surgery in 25 years. The first one was a C-section. I hadn't had anything else done. So the robotic assisted, I knew there were advantages to that. And Dr. Patel had told me, well, your incision will be about so there, and we'll have another little incision up here. And it'll be a small incision. That's how we get everything in there. And I'm thinking, this big? The hip joint's going to fit in an incision this big? You know, I mean, I'm a science geek. I know my hips, that's our area that's full of all the blood vessels and stuff. And I'm thinking, I remember, you know, big incisions from times ago. So I was actually kind of stoked about this whole robotic assisted surgery, because potentially that meant whenever I picked out my bathing suit, I didn't necessarily have to make sure it had bicycle length legs in it, you know, to cover up this incision. And I was right. I don't have to. The incision is almost minimal now. I can barely see it, but of course I'm twisting to try and see it. So it was easy. There wasn't a lot of pain afterwards. There was freedom of movement. The bandage stayed on like it was supposed to, and when it came off, I'm looking at it and I'm going, this is not any kind of incision. My mom actually looked at me, she goes, you can wear a bikini with that incision. Because my father had had double hip replacement years ago, and he's got a nice big scar. The other thing that I noticed too is I don't feel a lot of scar tissue. I run my hand up and down those incisions looking for those, because someone had given me the piece of advice to make sure I get me some liniment oil and a golf ball to rub and break up that scar tissue. Well, I'm not feeling any. There's no lumps or bumps underneath there. It's clean as my leg was before. So if you get the opportunity to do robotic assisted, you better jump on it. You better jump on it. My experience with it was fabulous, and I would highly recommend it to anyone.